Now I'm going to demonstrate a direct laryngoscopy technique with a bougie to intubate the patient. So I've been hand ventilating my patient. I've waited for my medications to work, and the patient is now relaxed and sedated. I'm going to place my bag down, remove my oropharyngeal airway. I will have suction nearby. I will look. If I need to suction, I will start with suctioning. If I look and I don't see any secretions in the mouth, then I'll have my suction on standby just in case I need it. First thing I'm going to do, I'm going to open my blade. I'm going to hold low on my handle. Down here, the butt of the blade should be at the butt of my hand. This is an extension of my hand now where I have the best fine motor control. Next thing I'm going to do is open the mouth. I'm going to take my free hand and I'm going to place it down on the molars of the patient. And the critical step here is to get a good scissor technique and scissor that mouth open. Now I've got my mouth open. I can take my blade. This is a Macintosh 3 blade. I'm going to enter to the right side of the tongue. You can go in straight, 45 or a 90-degree angle. I typically go in at about a 45-degree angle, and I'm going to watch the tip of that blade go to the right side of the tongue, and I have slow, deliberate tongue control. As I get my blade around the base of the tongue, I'm going to slide it around the base of the tongue. Now I'm in the mouth with the blade. I'm going to take my free hand out of the mouth, and I'm going to start visualizing for vocal cords. On these stiff mannequins, you may have to back out a little until you see epiglottis pop down, and then the blade will go into the vallecula. I see the cords now. I'm lifting up. I'm keeping my arms straight. I'm bending at the knees to see the cords. I have peripheral vision by standing back here. Okay, so I'm in the vallecula now, and my assistant will hand me my bougie. Notice the Q-date tip and the curvature of the bougie, which is critically important. I'm going to hook the bougie in the corner of the mouth. I'm looking in the mouth right now. Now I'm going to bring it up towards the channel of my blade. Look down again. There's cords down there. I'm going to watch that Q-date tip. And notice how I'm down by the mouth. I'm not way up here with the bougie. I have much better control over the bougie down here at the corner of the mouth. I'm going to go ahead and inch my bougie down a little at a time. Once I'm in, I'll have my assistant place the tube over the bougie. Once the tube is here, my assistant lets go. I take control of the tube. Everyone lets go of the bougie. I have control of it now, and I'm watching here at the teeth. I'm watching the cuff pass the teeth. We break a lot of cuffs in the field, so it's important that you gently pass the teeth with the cuff. Now I'm looking down at glottis again, and I'm going to watch my cuff railroad over the bougie where I have control of the tube down here low by the mouth, okay? I want that cuff to go well past the glottis, and I tend to cheat a little deeper with my tube because it's easier to pull the tube out than it is to push it deeper once the bougie is removed. Once I'm happy that the tube is deep enough, I gently remove my blade. Holding the tube, I'm going to take my own bougie out. It's safest if you, the airway operator, removes your own bougie because it can get hung up, and pull the tube with it if you're not paying attention. Last step, I'm going to back the tube out to where I want it. Again, it's easier to back the tube out than corkscrew it back in deeper if it's not deep enough when you pull the bougie out. So on a male, I'll come back to about 23 at the lip. It's a good rule of thumb. I'm going to go ahead. Can you put some air in that for me? I'll hold this. And my assistant put the cuff up. We're verified correct depth. The cuff is up, and now we'll verify correct placement of the endotracheal tube. Bilateral breath sounds, equal chest rise as I squeeze the bag. And then, of course, your capnography. And then I'm going to take a blood pressure and secure the tube.